Welcome back. I'm Dr. Canapp here at the Veterinary Orthopedic and Sports Medicine Group, and we're once again going to get back to our Facebook Live sections and segments that we're going to be doing monthly. And we got a lot of great positive feedback last year on different cases, different products, different technologies that we talked about. The whole goal of this year's sessions is to really give back and give you some information, short little snippets about maybe conditions, products, supplements, things you can be giving your dogs, but really I wanted to take home that would have in a short period of time, just something that you can consider utilizing at home for your own pets. And we'll also go through cases. Periodically we're going to have veterinarians, technicians, therapists sending cases that are challenging. We had that one wonderful dog from Romania that we all helped last year that had the carpal injury, an agility dog. So we'll get back to those as well. In fact, we'll also do an update on that wonderful agility dog, sporting dog, to see how we're doing and cover that. Today's segment, though, is quite fascinating. It's something that is a whole world that I was not aware of. And with us, that's going to be doing a demonstration, is our little demo dog, Ginger, with Ginger's little ankle issue, and then Margot is going to be helping us as well. What we're going to be talking about today is dog beds. And I know you're saying, well, you're an orthopedic sports medicine specialist. Why in the world are we talking about dog beds? Well, I'll kind of explain how this happened. I was talking to an owner about a procedure that we're going to be doing on their dog, and they simply asked, they said, well, should I get a special dog bed for after you do the procedure, something that may cushion the area of injury or something that may be more comfortable or even therapeutic? And I'm like, no, a dog bed's a dog bed. And we have dog beds in our exam rooms, we have dog beds at home. Pretty much every room in my house has a dog bed for our dogs. But I never really thought about, could there actually be a difference between these dog beds? So when she asked that, I thought, boy, this is something I may want to investigate a little further. And it makes sense. If you think about your own bed at home, we'll go through great lengths of going to different stores, digging into information online. We'll go and actually test drive the bed, as well as I do. You listening, it may sound silly, but we'll go to different mattress places and we'll land these mattresses and try the different technologies and different thicknesses or stiffness. And I dug even further. And if you think about orthopedics, geriatrics, there's a whole world of dog beds out there, a whole world of human beds out there. And so the reason for this is because even on an operating table, there's a bed. If you think in a hospital ward, there's a bed. If you think of nursing homes, there's a different kind of bed. If you think of, just home care yourself, you have lower back pain, your post-ACL injury yourself, cervical pain, there's certain beds, certain mattresses, and certain technologies that are out there for you. Wouldn't it make sense that there is for dogs as well? Well, come to find out there is. Again, this is very humbling for me because there's a whole world that I should be aware of because of orthopedics, and I wasn't. So let me explain a little bit of some of the science of this, what's called dry flotation technology. And this isn't something that, that I came up with. This is something that's well documented in the literature, and we'll go through that a little bit. And now this technology has actually made itself into, or taken itself into veterinary medicine. So let me walk you through this. So what you're looking at here, this is a slide that explains dry flotation technology. And this is something that can be considered for a post-op patient. So say your own dog just had elbow treatments arthroscopically, or had a TPLO for a CCL tear, or has another soft tissue injury. This can not only be something supportive of that, but also therapeutic in the sense that this may be something that you want to use for your dog if it is an athlete or well-conditioned or someone that needs some extra support within their body. And what this is with dry flotation technology is it's low surface tension and gives you a constant sort of restoring. So if you look at these slides here, you can see on the left, this is the dry flotation technology, and you can see the distribution compared to on the right, which is this basic foam type technology. So there's an increase in distribution, but also it gives you a lot less issues as far as direct compression to that area. So it's going to help with blood flow, with body tissues, and also eliminate edema in that location. So this is called RoHo dry flotation, and it's a mattress system that provides increased capillary blood flow to the local tissues, exerting this uniform low pressure. So there's not a constant location of pressure contact, which can cause issues with circulation, pain, or in humans, if you think about it, even decubital ulcers. So you have a closer proximity of the capillaries to the skin, which increases circulation, and it really ensures a better oxygenation of nutrients to the cells. So this allows what we call 6 degrees of freedom. So if you think about the bottom left where you can just see foam, which is in a lot of dog beds and even a lot of human beds, you can see we don't have that low friction and shear forces that are occurring, and you don't have that 6 degrees of freedom that you would have seeing this dry flotation technology. So when I heard about this, I said, yeah, this sounds great. Is it really just a gimmick? Is it really just something that is out there to kind of enlighten us and make us think that there's a big difference between human beds or even dog beds? And I'm a big fan of data. It's all about evidence-based medicine. So I said, well, you know what? Let's see if there's actually any data out there. So I went to Google Scholar, I went to PubMed, and you can see here in this slide, there is a ton of data out there on this dry flotation technology and the various different types of technologies for beds. And many of these, as you can see, are human journals and human articles, and they're fairly recent, 2016, 2014, 2015. And this is just an example of some of those studies where they actually use really, really scientific type technologies and very strong evidence-based medicine, looking at the different areas of either foam resistance or what we call the ROHO cushion. And you can see here, and just these, this is an area of increased circulation we can see in the one, and increased pressures that you see in the opposite one. And this was based off an MRI. So they basically had patients sitting in MRIs with the different types of cushioning, either the reference foam or the ROHO cushion. So this was a fascinating study that I came across, and this looked at pretty much all the different technologies that were available. And what they looked at was basically the same thing, pressure points, and they looked at specific thermography, if you would, as well in these examples. And the dry flotation technology, you can see over here to the far right, had the best ability to distribute the forces and increase circulation, had the decrease, as you can see, in pressure contacts compared to what we had with the others. So the whole idea for this was taking a technology that is well accepted in the literature on the human side and bringing this to the dog side. Not just veterinary medicine. We're not just talking about the use of this in dogs that may have an injury, such as what you can see here with Ginger. If you look at point of contacts we have with the elbow, if we look at the foot, if we look at the knee, if we're talking about spine, anything we can do to decrease surface area pressures and contact is going to help with circulation, help with comfort and healing. But say, for instance, you have a dog that's geriatric. Say, for instance, you have a dog that's arthritic. Say, for instance, you have a dog that does performance work, Schitzen, field trial, flyball, agility. Those dogs have increased tension in those locations just from competition. So wouldn't it make sense that we want some sort of dry flotation type of bedding, if you would, for them as well? Well, this is a product by a company called Underdog, and Underdog is the one that actually created this technology for the canine space, and this is available, and hopefully someone online will be able to give some of the contact information for Underdog. But let me just show you an example. So we'll go ahead and slide Ginger off for a second. And this is just an example, I'm going to slide this out, of what you're looking at with this dry flotation type material. And this comes off very, very nicely. You can see Ginger was on here with our little bed, with our little Chewy earlier, and so we can see that, let's whack myself in the face, and you can see this thing can just be taken and thrown into the washer. This is that 6 degrees of freedom that we have with this technology. And so basically these are cells that then allow for the different contact distributions within the points of the body. So whether it's a knee, an ankle, a hock, a shoulder, the back, the spine. So, and then this is one of the portions here. You can see there's another one in here as well. And so it was really fascinating. I think you guys remember that we did the sports medicine conference for performance dog owners a few months ago. Really great feedback on that. And we happened to have the Underdog bed there when we were doing the live segments and doing the case presentations. And we had one right in the very center. These dogs would come over and just plop right down on those dog beds and seem very, very comfortable. And as you probably realized, and you'll see once this recordings go live again, Susan Garrett was there. And Susan Garrett was like, what is this dog bed? And actually wanted a few of these dog beds and now has them for her dogs up in Canada as well. So go ahead and check it out. It's the Underdog technology. It's based on this dry flotation technology, and there's a lot of evidence. You can simply go to Google Scholar or PubMed and type this in and look for the data yourself. So hopefully this was helpful. The idea or the goal here is, once a month, changing it up a little bit. If there's a new supplement that's out, if there's a new technology that's out that I think something that you could bring home for your canine patient, for your canine athlete, or your canine companion at home, I hope to be able to go ahead and give some more information. Just a little teaser on next month, February. What do we have in February? We have Valentine's Day. And so our idea is something that you can take and give back to your canine companion at home. Okay, so I'm going to give a little teaser here, so keep your eye out, but we're going to be having a special guest there, and we're going to be talking about something that really shows that you care and give some love back to your canine companions. So until then, hopefully this was helpful. Again, Dr. Canapp at the Veterinary Orthopedic and Sports Medicine Group. Any questions at all, go ahead and feel free to chime in, post those on Facebook, and we'll get back to you as soon as possible. Thanks so much, and have a great day.